Normally, the eyelids completely open and close due to a normally functioning facial nerve. However, if the facial nerve branch that goes to the eyelids become damaged from trauma, infection, or compression, it may become impossible for a patient to close the eyelid completely. This condition is known as logophthalmos. Incomplete eye closure risks exposure keratitis, corneal ulceration, and potentially even permanent vision loss. One way to treat this condition is to put a weight on the upper eyelid, typically made of gold or platinum. This additional weight on the eyelid allows for complete eyelid closure. First, a 2 to 2.5 centimeters incision is created in the supratarsal crease of the upper eyelid. This incision line is approximately 10 millimeters from the inferior margin of the upper lid. The incision is carried through the muscle, down to the level of the tarsal plate. A small pocket is then created between the muscle and the tarsal plate. The implant is then placed and secured using sutures. The muscle followed by skin is then closed over the implant.